Good morning, all of you. My today's topic is about space infections. So before going into the details, we'll check what are the contents. So you have how there is an introduction about what is space infection, what you actually mean by space infection, and what contains, what are the anatomical boundaries of space infection. And then you need to classify the spaces of head and neck, how you classify spaces of head and neck. Then microbial aspects, what kind of organism is causing this space infections. And we will look into the details of the surgical anatomy of the facial spaces. Individual spaces will have anatomy, what are the boundaries we will discuss. So we'll go to the introduction part. So what worse that can happen from a odontogenic infection? So if an odontogenic infection, you know that it is either a tooth related infection or it can be periodontally infection. So if you are not treating that particular infection at that particular time, what worst can happen? So the infection can progress to the adjacent tissue spaces through the least path of resistance. That means the path of least resistance, the infection can spread from your teeth to the adjacent areas. So there exist facial spaces that are potential spaces of face. So that is, these are areas covered by loose connective tissue. Our facial areas are what you call it, covered by areas of loose connective tissue. So in normal condition, there won't be any tissue spaces. But in case of infection, this loose connective tissue can be easily pierced by infection. Okay, so that causes a potential space infection. So we will discuss in detail about individual spaces when we come to the upcoming slides. Now we'll just look into the classification. Okay, so in that you have, broadly you can classify it as primary spaces of head and neck and secondary spaces of head and neck. So in primary spaces, you have maxillary spaces as well as mandibular spaces. In your maxillary spaces, you have your canine space, buccal space, temporal space, infratemporal space. And coming to the mandible, you have your submental space, sublingual space, submandibular space, submasseteric space, or pterygomandibular space. Then you have your secondary spaces, your superficial temporal space, deep temporal space, lateral pharyngeal space, retropharyngeal space, and prevertebral space. Okay. Now we'll check into the details. What are the pathways of spread of your odontogenic infection? So imagine you have invasion of the dental pulp by bacteria after decay of a tooth. So that is a usual normal phenomena. The dental pulp is invaded by bacteria due to infection. So what happens later? There is inflammation, edema, and there is lack of collateral blood supply in that area. So then what happens is there will be venous congestion or avascular necrosis. The necrosis happens due to avascularity. That means less blood flow in that particular area. So this particular area can act as a reservoir for bacterial growth, be it aerobic bacteria or anaerobic bacteria. It is an excellent reservoir for your anaerobic bacteria to grow. Then there is a periodic egress of bacteria into the surrounding alveolar bone. And if you are still not treating that particular condition at that time, what can happen? That can go into your the periapical infection can progress to other areas or spaces. So this is a pictorial representation. You have your caries involving your pulp, and if you didn't treat it, it is going beyond your periapical area and can reach to the adjacent space. It can reach your loose connective tissue and it can go into the adjacent spaces. These are pictorial representation of a particular infection from a lower tooth, preferably a lower premolar, which has spread into the adjacent space. So it can be a submandibular space infection, or it can go into your submental space, or it can go into your secondary spaces. Okay. Now we'll just discuss about what are the factors which influences the spread of infection. So the factors that influence the spread of infection are general factors and local factors. So in your general factors, first and foremost thing is your host resistance. So you should know how the host condition is, the general condition of the host. Host means the person himself or herself. So the host resistance. If the patient is generally having good immunity, just good resistance to your organism, the chance that you may get a space infection is less. That means if the patient is not immunocompromised, that is one category, one factor. Then the other factor is your virulence of organism. So if the microorganism is virulent, that means it has more potential to pierce a particular area because of its high virulence. There are chance of spread of this infection. Then the third factor is compromised host defense. So say for example, if the particular patient is having any other infections or any other comorbidities, the main thing is your uncontrolled diabetes patients, or patient is on any other immunosuppressants, or patients having any other conditions, CA patients, all these things, all these patients will have high chance of spreading, or any other immunocompromised diseases like your hepatitis B or HIV, all this infection. Okay, then combination of both, all these factors combined can also cause spread into the adjacent spaces. Then the local factors include anatomical barriers such as alveolar bone, periosteum, and adjacent muscles and fascia. So if the intact, the areas where the infection is spreading is also very important. So if there is anatomical, if there's any anatomical factors like alveolar bone, periosteum, and adjacent muscles and fascia, it varies depending on the strength or the thickness of the bone. All these things, their spread may vary in different areas of your face. Okay. So in the coming to the microbiology of these things, you can see a mix of aerobic and anaerobic flora in case of space infection, and 25 to 30% you can see exclusively anaerobic organisms, and 5% you have exclusively aerobic organism, and more than 90% contain some anaerobes, because you know that because of avascular necrosis of the bone or avascular necrosis of that area, which will be an excellent breeding ground for anaerobic organism. Okay. So these are the frequently isolated organisms. You have your aerobic streptococci, Streptococcus miliaris, Streptococcus sanguis, Streptococcus salivarius, Streptococcus mutans, alpha hemolytic streptococci. Then you have your anaerobic streptococci like your Peptostreptococcus. Then bacteroids like your Porphyromonas, Prevotella, Fusobacterium. All this are responsible for your what do you call it? Space infection. So when you take a swab from this particular space infection, you collect the pus from that area, you will be finding out these particular microorganisms. Okay. Then we will discuss about the surgical anatomy in the upcoming slides.